Hello, this is Debbie Lynn Toomey, Health and Happiness Specialist, owner of Ultimate Healing Journey. I empower burnt out nurses how to use research proven skills to boost their energy, happiness, and resiliency so they can go home feeling good about their work and also themselves. Today is day 1 of 5 of the Burnout in Nursing mini series that I'll be offering through Facebook and also LinkedIn. So, burnout is something that is near and dear to me because it's something that I've experienced in the past. It's something that while I was experiencing it, I didn't know that I had it. All I knew was I felt miserable, exhausted, tired. I felt lousy and I was just so impatient. I couldn't sleep. And when I did sleep, I would wake up in the middle of the night thinking about what I forgot to do. And then when I would wake up, and think about work and dreading to come into work. So I don't know, nurses, if you've experienced any of that, but I certainly have. So burnout is something that is prevalent in nursing. And I was just reading a journal, the Healthcare Manager Journal, and it said there that the nursing shortage has doubled compared to what it was a few years ago. And that is causing burnout because there are less nurses and there's still a lot of work to be done, a lot of patients to take care of. And as we know, the patient's medical condition is becoming more and more complex. And there's more and more that we need to do for these patients. And if there's less available nurses to work, that puts a lot of burden and demand on the nurses who are actually working in the hospital setting, in the clinics, out in the community, whatever practice that you work in. So there's a lot that nurses need to do for others. And with that, there's little time to take care of themselves. Sometimes there's no time for breaks. And sometimes when there is a break, we're eating as we're doing the charting. We're working on the computer as we're trying to eat our lunch. I remember when I used to work the floors, and when I knew that I was going to have a busy shift, I would bring a sandwich with me instead of bringing a salad, because eating a sandwich is easier because I'm able to hold the sandwich with one hand and do my computer charting with the other hand. And it was quicker to eat that way. So anyways, today is going to be, I'll be describing what burnout is. So according to an American psychologist in the 1970s, and I'm going to be looking down at my notes from time to time. I just want to make sure that I give you the correct information. According to the psychologist Herbert Freudenberger, in the 1970s, he was the one who first used the word burnout. And according to him, burnout was a state where a healthcare provider was experiencing compounding stress while at the same time trying to meet his or her high level of standards. Okay, so it's just a conflict sometimes when we can't give the standard of care that we want to give to somebody because of all of this different stressors that's happening. So according to that psychologist, Herbert Freudenberger, that's when burnout happens. Now, there's also another definition. There's many different definitions of burnout out there, and there's another one that has, this one is described by Maslach, and he describes it as having 3 components. The first component is emotional exhaustion. Okay, the second one is depersonalization, and then the third one is inefficacy. So as I'm going to describe each of those 3 components simply so that you, as I'm talking, I invite you to think about if you've ever experienced them before or if you're experiencing them now. Again, when I was burnt out, I didn't know I was burnt out. All I felt was I was just miserable and tired and irritable. Okay, so again, think about these terms as I'm describing them to you. So the first one is emotional exhaustion. Basically, that's what it means. Feeling empty, like running on empty. Like I feel like I have nothing else to give. Okay? You're depleted, emotionally depleted. Okay? Have you ever felt that? The second one is depersonalization. Depersonalization, according to Maslach, is feeling detached and having a lack of compassion towards another person. So not really caring anymore about your actions or what your nursing practice is doing on another person. Okay, so depersonalization. And then the third one is inefficacy, is feeling that you didn't do a good enough job. Okay, again, if you are one of those people with a high level of standards and it's you feeling like you didn't do your best, you come home feeling like I worked really hard and I was running around like crazy, but I don't think I did a good job. Okay, have you ever felt like that? I certainly have. Okay, so those are the three components. Again, think about, have you ever experienced that? Or do you see any of your colleagues experiencing that? Because everybody will show their burnout in a different way. Okay, I've worked with people where burnout to them is just them complaining that they're tired. It's those nurses that you see working really hard and they have this tall cup of coffee with them because they're so tired, but they still need to get the work done. Or I've worked with people where they're yelling. They are, sometimes it's just that's how they react to the stress. They're yelling at their patients sometimes, or maybe the doctors or the other nurses. Okay, I've worked with other nurses where burnout to them is just they cry, so because it's just so consuming and so overwhelming that they leave work crying. And I believe I was one of those nurses. So again, think about burnout and think about how how it's manifesting in you. Okay, what does burnout seem like to you? Okay, so when I was experiencing burnout a while back, the way I took care of my miserable feelings was eating. I ate a lot. I ate and ate. I snacked and ate when I had the chance. And it became like a very bad habit. And what ended up happening was I ended up gaining like 25 to 30 pounds. Okay. I remember one day somebody asked me if I was pregnant. And you know what? I wasn't. And that made me feel even worse because I was overweight and somebody thought I was pregnant. So burnout, I dealt with my stress and burnout by eating. Okay, so I don't know. Think about how you deal with your own stress. Do you eat a lot? Do you drink a lot? Do you shop a lot? Do you cry a lot? Think about how you manage it, okay? Again, one of the best ways that we could start taking care of ourselves, especially when we are stressed and burnt out, is to acknowledge it. Because when we cannot acknowledge it, then we can start making healthier choices to deal with the impacts of the stressors even more. Okay, so I'm going to ask you, please add your comments below. My question for you is, have you ever suffered burnout? And if you did, what did that look like for you? Okay, and if you did know at the time that you were burnt out, what did you do to help yourself feel better? Okay, again, one of the best ways we could start taking care of ourselves is acknowledging what we are experiencing inside. When we can name it, then we could start doing something about it. Okay, so I invite you to write down your experiences below, because what you could share with me and others, it's going to permit others to also share and also to recognize the suffering, the pains that they're going through. Okay, so that's it for now. My name is Debbie Lynn Toomey, Health and Happiness Specialist. Tune in tomorrow where I'll talk a little bit more about burnout and some causes of burnout. Okay, so thank you so much. Take care. Oh, and please, if you are a nurse, please share this video with other nurses and invite them to ask questions if they have, because I'd love to be able to answer them if I can. And if I don't have the answer, I will certainly look up the answer for you or ask somebody who can answer. Thank you so much. Have a great day. Bye-bye.